Thanks for tuning in for the third instalment of my top 10 tips for preparing for pregnancy. Let's continue with tip number 6, reviewing your obstetric history. The preconception visit is the perfect time to review any prior pregnancies. Is there a history of pregnancy loss, including miscarriage, especially for recurrent, or stillbirth? If so, have appropriate tests been done to try and identify a cause that can be treated and thus prevented from recurring? Is there a history of an extremely preterm birth or mid-trimester delivery? This usually necessitates interventions in future pregnancies, but occasionally some of these interventions, such as a laparoscopic transabdominal cerclage, are more safely performed prior to another pregnancy. What was the mode of delivery in previous pregnancies? This may impact upon the timing of a future pregnancy. For example, for women who had a caesarean section and are hoping for a VBAC next time, there should be an interdelivery interval of at least 18 months. Were there any significant complications in previous pregnancies, such as severe pre-eclampsia, severe intrauterine growth restriction, or gestational diabetes? If so, certain blood tests may need to be performed, and a discussion about preventative measures should take place. Has a previous pregnancy or postnatal period been associated with significant anxiety or depression? If so, it is vital to ensure adequate support is in place to optimise mental health pre-pregnancy, as this improves your ability to cope with pregnancy and parenthood and to bond with your newborn. Have any children been born with significant genetic conditions? If so, IVF with pre-implantation genetic diagnosis may be considered. Moving on to tip number 7, it's important to review your gynaecological history. This is the time to discuss any relevant information that relates to your uterus, ovaries, cervix and vagina, both in terms of structure and function. The following factors should be considered. Is there a history of relevant gynaecological conditions, such as polycystic ovarian syndrome, endometriosis, or very irregular or long menstrual cycles? If so, your chance at spontaneous conception may be reduced, and interventions, both lifestyle and medical, may enhance your chance of ovulation and therefore achieving a successful pregnancy. A number of women spend months or years trying to conceive when they are not even ovulating, and this should be addressed before potentially wasting a significant amount of time trying to fall pregnant without all the essential elements for conception in place. Are you due for a cervical screening test, previously known as a pap smear? This is the current method used to screen for cervical abnormalities and cancer. The pre-pregnancy appointment is an opportune time to ensure these are up to date, and if not, to perform one. As this test involves touching your cervix, it is ideally performed pre-pregnancy, so to avoid spotting during pregnancy. We'll now discuss tip number 8, finding your fertile window. In order to optimise your chance at falling pregnant as quickly as possible, it's important to try and determine the timing of ovulation. For women with regular cycles, this is relatively easy to work out. Ovulation will occur approximately 14 days before the first day of your next period. For women with a 28-day cycle, this will be day 15, counting day 1 as the first day of your period. For women with irregular cycles, this is far more difficult to ascertain. Here, an obstetrician can help you with strategies and techniques, such as using ovulation prediction kits to determine if and when you are ovulating. Furthermore, it's useful to know that sperm can live for up to 5 days in the female genital tract before being fertilised, whereas an egg dies within 12 to 24 hours of ovulation. Therefore, intercourse occurring between 5 days prior to and on the day of ovulation may lead to a pregnancy. This is considered your fertile window. More specifically, the highest probability of conception occurs when intercourse takes place 1 or 2 days prior to ovulation and on the day of ovulation. I use an analogy here that I find quite useful. I want you to think of conceiving as being analogous to the paparazzi trying to get the perfect shot of the biggest star as they walk down the red carpet at the Grammy Awards. I've been told by my wife in no uncertain terms to use Beyonce. If the paparazzi know Beyonce is arriving at 9 p.m, they aren't going to arrive at 9 p.m. too, as they'll end up at the back of the crowd, unable to see her at all. Instead, they will aim to be the first there at 9 a.m, right at the front of the pack, so they are poised and ready to capture her as she arrives. Now, think of your egg as Beyonce and the sperm as the paparazzi. You want the sperm lying in wait to fertilise the egg as soon as she's released. So I advise patients trying to conceive to have unprotected sex at least every second day during their fertile window in order to maximise the chance of conception. Stay tuned for the fourth and final instalment of my top 10 tips for preparing for pregnancy soon.